am Dr. Rahul Kulkarni. I am a consultant medical oncologist practicing in Pune. Today we are going to discuss about pancreatic cancer. Now, pancreas is an organ which is located between our stomach and small intestine, and it is responsible for secretion of digestive enzymes and also insulin, which is a hormone useful to control our blood glucose levels. Now, pancreatic cancer is not very common cancer as such. It ranks about 12th most common cancer in the world, but it is almost a fourth leading cause of cancer-related deaths. It's a dreadful cancer because it is most commonly detected at an advanced stages. Though we see more commonly these cases in elderly population, nowadays we are also seeing patients in the young population as well. And that is why it is important to know about this cancer so that patients should present to us at early stages and we can increase the chances of the cure. Now let us understand what are the most common signs and symptoms of pancreatic cancer. The most common symptom of pancreatic cancer is a vague abdominal pain, more commonly located in the upper abdomen, and sometimes it can also radiate towards the back. The second important symptom is an unexplained or unintentional weight loss. Patients generally present to us with a sudden weight loss of about 5 to 10 kilograms over a period of 2 to 3 months. They can also have a loss of appetite or aversion towards food. And sometimes patients also can have jaundice, and that is particularly because of the location of pancreas and the tumor, which can cause compression of the bile duct. In most of the cases, patients can also be asymptomatic till the disease becomes advanced and spread to the other parts of the body like liver, and that is why sometimes pancreatic cancer is also called as a silent killer. Now let us see what are the causes, or what we call it as risk factors for pancreatic cancer. Some of the proven risk factors for pancreatic cancers include smoking, obesity, diabetes mellitus, chronic pancreatitis. Sometimes it can be familial or genetic origin, and in the rest of the patients, we generally cannot find any specific cause as such. So, whenever patients present to us with these kind of symptoms, they need a proper evaluation, which includes radiological evaluations like a ultrasound of the abdomen, and most importantly, what we perform is a contrast-enhanced CT scan of the abdomen, which tells us the exact site and the extent of the tumor. We also do some blood tests, which includes a liver function test and a blood tumor markers like CA19-9. After the radiological and biochemical evaluation, the diagnosis has to be confirmed by a biopsy, which can be done either endoscopically or under the guidance of a CT scan. Now, after we confirm the diagnosis, next comes the treatment. Now, it is important to understand that the treatment of pancreatic cancer is best done in a multidisciplinary team, which comprises of surgical oncologist, medical oncologist, radiation oncologist, GI surgeons, and radiologist. So, treatment of pancreatic cancer depends generally on the stage of the disease. Broadly speaking, we categorize pancreatic cancer into 3 categories. One is the early stage, that is, when the tumor is limited only to the pancreas, and these kind of patients can be cured with surgery and followed by chemotherapy. Nowadays, surgery can be done by various advanced techniques. Initially, only open technique was available, but now we have robotic assisted techniques or laparoscopic techniques which can be done under the guidance of properly trained oncosurgeons and GI surgeons. Second category is the locally advanced, or what we call as borderline resectable. These tumors are a bit advanced for upfront surgery, but still nowadays, with the newer chemotherapy protocols and the radiation techniques, they can sometimes be downstage and later operated, and still we can give them one chance of a curative treatment. The third category is the metastatic pancreatic cancer, where the tumor has already spread to the other sites like liver or lungs, etc. Unfortunately, these patients cannot be cured, but now we also have good multiple chemotherapy options. Some of the targeted therapies, immunotherapies are also coming in picture. And with the combination and sequencing of these treatments, we can still prolong the survival of such kind of patients with a good quality of life. So the crux is that, or the message which I want to give to the audience is that pancreatic cancer can be cured if we detect it early. We can also reduce the risk of pancreatic cancer by following simple steps like stopping smoking, maintaining a healthy weight and diet, and early screening in case of family history of pancreatic cancer. If anyone has symptoms which are suspicious or suggestive of pancreatic cancer, like what we have discussed, please, they should never neglect it, and they should seek expert opinion from gastroenterologist or oncologist if required at the earliest. Thank you very much.